I'm really delighted to introduce Joel Berg, who is the Executive Director of the New York City Coalition Against Hunger, who is a former Clinton USDA employee. He's written extensively around hunger issues, including a book called You Can Eat, How Hungry is America, and he's joined by, I hope I pronounce this correct, Nermin Tadros. Am I close? And we're delighted. Nermin is a client and will give us a sort of unique perspective as well, and so very appreciative of that, and let me turn it over to you, Joel and Nermin.
Nermin, if you would go first, if we'll both testify and then answer questions.
That sounds great.
If you could also both use the microphone when you're testifying so that we can make sure that it's being recorded. And as a reminder for those of you who came in and who were not here this morning, this testimony and this hearing is being recorded, audio recorded and video recorded, and will be made available to the public. Okay.
Go ahead.
Okay. My name is Nermin Tadros. I am a member of the Food Action Board for the New York City Coalition Against Hunger. The board engages food insecure New Yorkers in telling their stories and working to improve public policies in order to end hunger. I am testifying on behalf of the approximately 1.4 million New Yorkers who live in food insecure households. I want to first thank the National Commission of Hunger for inviting me to testify here today. I live on Staten Island with my husband of 10 years, Midhat. We arrived in the United States in 2010 from Egypt. We are grateful that America took us in, and we are desperate to work hard and get ahead, but the reality is that we have often faced hunger. We want to work hard and achieve the American dream. But even though I have a bachelor's degree in political sciences and economics, I have only been able to get a part-time blue-collar work. I previously worked for a number of years part-time at a major nationwide retail store, always asking for more hours. At most, they gave me 12 hours per week of work, if I was lucky. This meant my husband and I were often behind on the utility bills because we needed to buy food. I was paid $8 per hour, and then after my bosses agreed my performance was good, they raised it to only $8.20 per hour. After I questioned why the raise was so small, they reduced my number of hours. I believe some companies purposely keep employees on part-time to avoid paying benefits, as well as continuously bring in newer, younger workers who are paid even less. This seems to be a common practice, unfortunately. Currently, my husband and I both work as many hours as we can per week, delivering food in a truck at night, earning $8.75 per hour. I still struggle. Unfortunately, this happens not only to me, but to so many other working people I know. My husband and I each get about 20 hours a week, earning $700 per person per month. $1,400 for the two of us. Even in the relatively low-rent borough of Staten Island, our rent is $1,100, leaving only $300 per month for food, clothing, transportation, and every other expenses. Our Metro card alone to get to and from work cost $5.50 per round trip, equaling 63% of 1 hour's pay. Basic math explains why we don't have enough money for food. I eventually applied by mail to the New York City Human Resources Administration, HRA, for SNAP, and the application process was horrific. The agency lost my supporting documents. Then they lost my documents for a second time. The third time, I have to spend $12, quite a sum of money for us, to FedEx our paperwork to HRA. But we were told that the documents arrived few hours after the deadline, and we were denied for benefits. The bureaucracy was worse than even Egyptian bureaucracy. I applied again, and we were finally granted the SNAP. Even after getting benefits, the city continued to hassle us. They repeatedly told us that because we didn't have children, We were so-called able-bodied adults without dependents, and that we had to take extra time to document that we are working. When our employers, against our will, reduced our hours for work, the city made it sound as if it was somehow our fault and that we didn't want to work. This treatment was humiliating and insulting and upset us greatly. I'm glad that the city now makes it easier for so-called ABAWDS, which is the able-bodied adults without dependents, to get food help. But we still have to repeatedly recertify our SNAP eligibility with the city. My husband and I now receive $180 in SNAP. We also go to pantries and get extra food most months. Meanwhile, every trip to the supermarket is an extreme balancing act, which means I can only buy food that's on sale. Some weeks I can't buy protein such as meat and seafood if it's not on sale. In order for my SNAP to last till the end of the month, I don't have another choice. Basic match again explains why we struggle. Two people get around $180 worth of SNAP per month. It means $90 per person divided by 30 days of a month. So the balance for each person daily is $3. This is $3 for 3 meals, which means $1 a meal. And I understand that USDA guidelines say that SNAP is supposed to be supplemental, but that I am supposed to use other money for food. But what if I don't have another money? What would you buy with $1 a meal? How could you feed a working body on $1 a meal and afford life? It's impossible. I have to buy what's $1 a meal, which makes healthy food like meat, seafood, fruits, and vegetables, which is tough to purchase. I want to eat healthier, but food is expensive. These are not choices I want to make, but they are the only choices I have. I have to think millions of times before swiping my EBT card for cheese that costs around $6 a pound, or some cold cuts. I'm very grateful that America took in me and my husband, but sad reality is that by some measures, Egypt provides more support than America to aid low-income families. It's just too hard for working people to survive in America today. And it's not only me who thinks that. I bet this is what every working person who relies on SNAP thinks. It shouldn't be this way. I shouldn't have to choose between my rent and food, or have to question myself before I buy food. It's not healthy and not correct. And in New York City alone, there are 1.7 million people who rely on SNAP, just like me. Most are working people, just like me and my husband. Many are kids and seniors. They are my family, friends, neighbors. Some of them, other than Food Action Board, are here with me today. We all want higher wages, but I worry that if the minimum wage is raised, we would lose all our SNAP benefits. My husband and I would be worse off. We must raise the minimum wage, but also ensure that income cut-offs for SNAP will rise at the same time in order to ensure that wages hikes increase, not decrease, the ability of workers to feed their families. Only when wages rise high enough for a family to be able to fully feed their families should SNAP eligibility be ended for that family. It should also be quicker, easier, and less humiliating for people to get SNAP. And the benefits should be raised to enable families to obtain a full supply of healthier food. I think stores should be further subsidized to give special discounts to people who purchase food with SNAP. In a country as wealthy as America, no one should go hungry.
Thank you very much.
Thank you so much.
Do you want us to reserve our questions till you're both
If that's
finished?
okay.
Sure. Yeah, that would be fine.
And respecting your time, I will use less.
Appreciate your written testimony too, Joel. Thank you.
You're very welcome, as always.
I'd love to get a copy of.
We will do that as well. First of all, I want to thank the commissioner as a whole and the commissioners for doing this. I do hope you understand, always appreciate the public service that each of you have offered. I say that sincerely. I thank all our Food Action Board members for waking up very early, especially you for coming here and having the courage to tell your story. Why I get so passionate about this is I keep meeting people like her, and I keep hearing their stories time after time and time again. I don't meet the stereotypical people from the other side who just don't want to work, who have to be forced into working, who have to have their grocery baskets micromanaged. Well, respect, that's a lot of think tank talk. I don't see that in the real world, and I don't think the data supports that. Let me give you one statistic from the U.S. Census Bureau. Between 2009 to 2011, well, about a third of American families live below the poverty line for at least one of those months out of 36 months. Only 3% of families were poor for each of those 36 months. 3%. A whole national debate is over this so-called underclass that just don't work. They're going to be poor from generation to generation. They're going to be hungry from generation to generation. As you know, less than 10% of the Americans are getting cash assistance today. Now claiming that SNAP is really cash assistance is like the people who can't accept that the Soviet Union went away, so they have to sort of manufacture some new thread and, oh, that's the same as the Soviet Union. This is the equivalence of welfare. It's never been the same as welfare. I think that if someone's trying to work full-time and can't get ahead, the American system is fundamentally at risk. So my first point, orally, I will make, is that I think the evidence shows the main problem is not the behavior of low-income people. With all due respect, it's not family structure. You can say correlation is not the same as meaning one thing causes the other. We know it's hotter when the sun is out, but that doesn't mean that being hotter causes the sun being out. I believe family disillusion is caused by poverty. Now, let me specifically address why I think it's actually quite a mistake for the Commission to focus on just very low food security. The truth of the matter is that the data shows people come in and out of food security, in and out of very low food insecurity. As I corresponded with Dr. Frank, sometimes people are in marginal food security, not even characterized as food insecure, and can be very low food insecure one day. It's a point at time on a graph. And so just technically pinpointing the time that person is going to be very low food secure, or whatever you want to call it, hungry, although the Bush administration, as you know, stopped using that word, and then just apply an application of some sort of benefit or help just to them. I understand the desire to do that. I'm a taxpayer too. I want my tax dollars to be used as well as possible, as targeted as possible, but let me respectfully suggest that's impossible. It would be like trying to address flu and saying to get rid of flu, we're only going to find the people who are currently suffering from the most severe types of flu and just apply medication to them, when we all know to end flu, we have to yes, treat the people currently suffering, but also apply a broader public health system to prevent people from getting flu in the first place. So I would argue that A, it's not going to work. B, I would argue that it goes against the broad mandate that Congress gave the Commission. It didn't say just focus on very low security. Now, I will admit hypocrisy right up front, because in a few seconds I'm going to tell you to ignore part of the mandate that says don't spend any more money. But I will say that I don't think that's the mandate. And lastly, I would say, I will be blunt, as you know I am. I believe adopting that would advance a far right-wing political agenda to basically say that the broader number of 49 million people in food insecurity isn't really a problem. And should you think I'm paranoid, I would suggest the previous person prove that's exactly the point. It's been a long agenda of the right to say this isn't a real problem, so wages aren't a real problem, poverty is not a real problem, because it's only this really, really small part of the population. It only happens rarely. I will move towards solutions, and I do think we can have a bipartisan consensus on this, but not dumbing down the debate, not saying, if I may, we're going to take 10 good ideas that have been demonstrably proven true and 10 bad ideas that have demonstrably false, and by lumping them all together, we'll have smart public policy. I note we're in the Rockefeller Institute, and if you tell Nelson Rockefeller you're going to solve a major problem without solving any more money, he would laugh at you. I drove up here on the thruway past the new Tappan Zee Bridge, and the day you can show me to build a brand new bridge to move people and supplies without spending any more tax dollars is the day I'll tell you you can solve a major social problem like hunger without spending any more money. I do think the SNAP program should be modernized. I agree probably with you guys that we should dramatically reduce the paperwork states have to fill out. I adamantly oppose block granting it. My group's really a national organization now. I spend a lot of time in places like Mississippi, and I categorically reject that they manage federal programs better than the federal government does. And if states want to do it, let them spend their own money. And for all the attack of some on the right, this is basically a way to buy off Democratic liberal voters in liberal big cities. I will point out that of the 20 states in the union that have the highest rate of SNAP participation, 16 voted for Mitt Romney. Most are run by Republican governors. The take-up rate for SNAP is higher in rural America, which is disproportionately white, than urban America that is disproportionately non-white. So when key national political figures use the term inner city, inner city, I would respectively say that's race baiting, and again, mistaking the problem. I would say that there should be dramatic simplification, but the power shouldn't go to the states or the counties or localities. The power should go to low-income families. I've proposed HOPE accounts that would basically scrap the entire social service bureaucracy of America and allow low-income people to be their own case managers, with guarantees that we would not reduce their benefits, reduce their choice, but give them real hope for the future. When I drove up here on the thruway, I also note I grew up in Rockland County, that getting to Albany made us pass through a lot of toll takers. I did not meet a single human being coming up here because I had an easy pass. There's no technological reason that we are still going by the same STAP technology in most cases as we were in 1977 when the original Food Stamp Act that created the modern program was created. I will credit New York City HRA for being way out front in allowing people to apply online and submitting supporting documents. I think we can build on that nationwide. We can allow people to file by phone, and much easier. If you're going to lie, you can lie in person, you can lie over the phone. It does nothing to reduce fraud. I really wasn't going to bring up finger imaging today, but since you did, I would just urge you to look outside and report that the sky didn't fall. The things that people said were going to happen, the terrible, fraud epidemic that was going to happen if we stopped this process, which I don't think reduced fraud, didn't have an increase in fraud. I would say I would support stores having more requirements to have healthier food in them, and we strongly support higher nutrition standards in schools. I think big institutions should have the burden of improving these processes, not putting it on low-income families. And lastly, I'll make a call for universal school meals, not just scrapping the reduced-priced category, scrapping all the categories. I played very, very, very mediocre JV soccer. I was really bad. I spent more time on the bench than I did on the field. And yet my suburban, not poor school district in Rockland County gave me a free jersey. Why? Because they argued me sitting the bench in mediocre JV soccer was a key educational tool for everyone. I've calculated we would save billions of dollars a year by just having free school meals for every American student. Even Thad Cochran, who's now the Republican chair of the House Agriculture Appropriations Committee, came to a conference I was at a few years ago and said that he thought we could save money if we just had universal meals for all kids. It would take away billions of dollars from bureaucracy, feed more children, improve the educational system, and just be a win-win for the American people. Yes, that would cost more money, but if Congress decided that to go after ISIS, they had to magically find, with no debate, $64 billion, which equals 128 years of federal funding for the National Summer Meals Program. If they thought this was really a priority, they could find more money to end hunger once and for all. Thank you.
Thank you very much.
Thanks, Joel, and your term. Appreciate it very much. You have the first question?
Sure, I would love to do that. First of all, I would like you to state your name again, madam. I'm sorry, I missed it the first time, and I don't have anything in front of me that says.
Nermin.
Nermin.
Yes.
Thank you, Ms. Nermin, for your testimony. I would like you to talk, if you would be willing, a little bit more about the dynamics that made you feel humiliated when you were applying for food stamps. And can you talk a little bit about what that experience was like and how that was caused and how we can avoid that in the future? What is that interaction? Why does that interaction take place, and what are some solutions to prevent that?
Well, when I applied for the first time, it went through online. Then on the recertification, I sent it by mail once. They called many times. I didn't receive anything. I told the coworker or whatever. I just submitted the application and everything, the documents. No, we lost it. I sent it again. They didn't receive it. I had to go to the office, which I have to lose one day of work. Then they asked for some copies or something I didn't have with me. They didn't tell me that on the phone that I have to have it. I had to go to work. I went to work. I submitted the application, the documents they needed by the USPS express mail. I missed just several hours. Let's say it was supposed to arrive on the 5th. It arrived on the 6th in the early morning. And like that, I have to reapply again.
Okay. Thank you. And what happens to you and your husband when you don't when the food stamps don't come through, or when you have to make ends meet in terms of cutting meals or cutting back on?
I had to apply to another food pantry, and I used my credit card.
Okay. Thank you.
You know, Kevin Concanon, who you know is the undersecretary, told us to be as bold as you're telling us to be. There is some reality, and I appreciate some of your analogies about the Tappan Zee Bridge, and you know, they resonate with me, even though we may not always agree on things. But I'm just curious. I mean, you mentioned something that appealed to me on the universal school meals. I've always been a big proponent. In fact, was the architect of the school breakfast mandate we have in New York now for needy schools and elementary schools. But those bureaucratic savings you claim we could save, I find that quite often bureaucracy is, even when you do something good like that, bureaucracy is sort of unwilling to dismantle itself enough to really realize those savings.
Well, they won't dismantle themselves. That's why we have government and elected officials, and hopefully some in New York, and I know some in New York aren't corrupt today. I must point out over and over again, the conviction rate of our elected officials, both in New York and nationwide, is far higher than the SNAP trafficking rate. I couldn't help but getting that in. Look, on school meals, part of the problem with the federal scoring is you don't save federal money on it because the vast majority of the bureaucracy isn't federal for school meals, and same for the rest of the safety net. The Food and Nutrition Service in Washington, even though they manage $100 billion worth of money, I think they have something like 1,300 FTEs. There's something like 60% of USDA's money and something like 2% of their FTEs. And unfortunately, the way federal budgeting rules work, if you eliminate the forms, you would eliminate over time people at the state education department who collect them, people at school districts who send them to the state education department, people at school level who then send them to the school district, and then the time of teachers in every classroom collecting the forms. Now, my idea about dramatically decreasing the safety net, no, over time, I think public employees can do something else more productive, but the truth is there would be resistance on both the left and the right. Many of my colleagues will argue that, you know, low-income people really need this intensive case management to get that extra help. For some, they might. For most, I'd say they're just poor and they need the help. My mother was a social worker, and she did case management. I think, God bless the social work mentalities, that everyone needs to be case managed. That may be the case in some, but I don't think that's the case for others. Groups like mine, we get a lot of money from SNAP outreach, and I'm not saying we consciously think we can't simplify the system because of this. I would gladly have my staff do other things and give up the grant money if we just made it easier for people to get the benefits. And then some people on the right, frankly, think an onerous application process makes it a burden, and it should be a burden because it shouldn't be easy, and therefore they support it. So there is an irony that some on the left and some on the right unconsciously, for totally different reasons, support a large bureaucracy. But I would support, and I think most low-income people would support, scrapping the vast majority. Would you prefer just to be able to apply on your own and fill out like a tax form and get your benefits if you're eligible? I'm sorry, I'm not supposed to ask questions.
That's fine. No, that's fine. You don't always do what you're supposed to do. That's fine.
I have a question. Do you have any more questions?
I will give you some time.
I want to thank you for coming, and I wanted to ask you some questions about your work history and also about other benefit programs in the city. Is that all right with you?
Yes.
Okay. So what I understood you to say was that you and your husband both are working 20 hours a week. Is that right?
Yes.
And you would like to work more hours, but you can't find an employer that will give you more than 20 hours a week?
This is what happens. Even I used to work in a big store.
Yeah.
Chain store.
Yeah.
They don't give you hours.
Now, one of the issues that is out there among low-wage employers that employ a lot of entry-level employees, is the effects of the Affordable Care Act, where if they go over a certain number of hours, you're right, they may be forced to have to provide health care benefits. So there's a 29-hour rule.
No.
Is it possible that that's the reason why they're not?
Well, what I know now, I quit a couple of years ago, but what I know now is that they don't provide health care.
Right, that's what I meant. If they
don't do it.
Right. So when are you currently working 20 hours a week? Mm-hmm. And what kind of work is it, and what are the hours? I mean, on a weekly basis?
We deliver chips in the city.
Chips?
We work on a truck.
On a truck. And your husband has a different job?
He actually got me this job.
Does
he works there. And
he works there also?
Yeah.
So you both work for a company that limits your hours to 20, and he got you the job. Mm-hmm. Oh, and now what about other programs in the city? Are you a recipient of any other benefit programs? Not health insurance, not Medicaid?
I have the Medicaid, and that's it.
So you have,
I hear about another programs, but I don't know how does that work.
So you applied for Medicaid at HRA as well?
Yeah.
Yes.
No, I have Medicaid only. I don't have except Medicaid and SNAP. That's
right.
it.
But Medicaid is something that you apply through HRA as well.
Oh, okay. I don't know that. All right.
Do you remember how that application process went, or the recertification process?
I just recertified for it. It just went through.
Yeah. And housing assistance? Any form of housing assistance or rental assistance?
No.
Okay. Thank you.
You have any questions?
Go ahead, Russ, you have another one. I have a few that are.
I had one last one. It's really a smaller question. You know that USDA tested a summer EBT program recently as a pilot because schools aren't offering meals in the summer,
Yes.
and the summer food program is underutilized. I mean, it seems from our reckoning that's been a pretty good idea, but trying to scale it up would be difficult too. I know that you would say we could build the Tappan Zee Bridge, but what do you think of the summer EBT program?
I should say, I think my top solution, I didn't say in my testimony, is creating more jobs and making sure they pay a living wage. So I want to be clear on that. I think we actually agree that work should be the centerpiece of social policy. And I also agree we can save a lot of money by scrapping the farm benefits, getting rid of ethanol subsidies. So I'll start with that. I do think we should expand the EBT pilot project. However troublesome summer meals are in New York State, other places I go to with hotter summers, like Texas and Arizona, where it's over 110 degrees for a week, forget about it. And not only should we expand the summer pilot, which basically says you can use the equivalent of an EBT card or your EBT card to get extra benefits over the summer, I do think USDA and legislation would have to change this, should take away some of the strict nature of the on-site feeding program. I'm sure when you're going to El Paso, you'll hear a lot about this idea that you have to eat it on site. I understand the city of New York might be dinged because they were working with a nonprofit group to distribute food on Main Street in Flushing, and then some auditor came back. There was no place for the kids to sit, so it's not a proper feeding site, and someone may have to pay back the money. That doesn't make a lot of sense to me.
So the sponsorship rules are really pretty onerous.
What happens, you guys are in government, at least the three of you, you know what happens every few years, there's some fraud somewhere, and government overreacts in the worst possible manner. They just pile on paperwork and paperwork and paperwork, which doesn't reduce fraud. It increases the number of people that can be blamed when fraud happens. If it's up to me, I'd have a lot less paperwork and a lot more inspectors. Because you can lie on paperwork. If you really want to find fraud in child nutrition programs, the fraud is making up numbers of kids. If you want to find out the accurate numbers of kids, have a fewer inspectors, they show up and count.
I have couple more when you're.
Yep, sure.
Say, Mr. Berg, the growth in the SNAP utilization in New York State and New York City during the later part of the 2000s was pretty dramatic, went up quite dramatically. And very low food security also rose up to or about 5% now. And that, what happened there? Is it, and do you expect very low food security to be dropping now or not?
Well, two questions. What happened was, I think it would have been far worse had not there been the growth of this safety net. As I mentioned, there basically was no more cash assistance. I have a far more nuanced position on that to discuss, here. But it is true that SNAP is basically the only part of the safety net left, the counter-cyclical safety net left. School meals didn't particularly go up in the recession. WIC didn't go up in the recession. So SNAP was about it, and I think the food insecurity would have been far, far, far greater without this massive increase in SNAP. And I'm sorry, the second part of your question?
That was the only question I want. That was one. The second question was, and this is a history question, and it's a little political. And if I don't have this
I
right,
hate to go there, but okay.
But I have this memory that at the very beginning of the President Obama administration, the First Lady and the Obama administration made a pledge, or maybe it was during the campaign, to end childhood hunger.
Yes.
And then that goal switched to focus on obesity. Can you tell us the history of that, or what was going on there? And do I have that right?
I certainly talked to those folks. I'm not serving the Obama administration, so I can't talk for the president. I can tell you I've been personally very critical of the president abandoning that pledge. I had some conversations from the very beginning of the administration that their messaging that didn't combine talking about obesity with talking about hunger was a huge, huge, huge problem. I'm very praiseworthy of what was in the stimulus package. I think that was a huge success and helped with the counter-cyclical nature of the safety net. I'm very supportive of the administrative changes that they've used, and I will, not to defend my own department, a lot of things sometimes you guys want them to do, I think is illegal. So I really urge you not to blame USDA as Congress. A waiver does not mean you can violate law. So I strongly support much of what they've done administratively, and I think the problems with Congress and members of Congress on both sides of the aisle who agreed to cut these benefits claiming it wouldn't hurt real people.
In other words, that vague memory is correct, that there was a commitment that then got sort of downplayed or shifted to something else.
Oh, yes, and by the end of 2015, when we're further away from that goal, as I predict, I will be very vocal in criticizing everyone who was responsible for not meeting that goal. I think it was a very doable goal. I don't know that necessarily everyone, when they made the goal, accepted that goal, understood what it was going to take to get there. Those of us who were supporting it understood it was going to take a massive change in the economy and a massive change in our safety net. So perhaps some people made it too cavalierly. And even when I criticized Mayor Bloomberg for making big goals, I never criticized him for making the goals. I criticized him for not keeping it. So I think government should make big goals, understand the resources and work it's going to take to get there, and then carry them out and hold them accountable for doing it. So I think it's a major failure of his presidency in the last number of years that we haven't done that.
Thank you very much. I think we're out of time for this particular
Thank you, both of you. We appreciate you coming, and I hope you can stick around to hear some more.